The double doctor strike, yes. Consultants and junior doctors in England are staging their first ever joint strike. This is the first joint strike of this kind in the history of the NHS. This strike, as you might be familiar with by now, will last 2 days. The one by the junior doctors is scheduled about for 3. Now, Jacqueline, lots of people on the side of the doctors, consultants and all the rest of it saying pay them what they're worth. The other side of this argument is, hang on just a nanosecond, coordinated strikes and all the rest of it. We've got waiting lists as long as our arms as it stands. Where are you on it all?
Well, I think this has gone beyond just what you would hear as a normal negotiation. I mean, the fact the BMA, an organisation that is supposedly representing these professionals, puts in a pay claim for 35%, which is ludicrous, and then tries to say it's worked it out on retrospective increases in over a number of years. Is beyond me as a former trade union negotiator. I certainly, we went for good deals, but this is nonsense. The fact now that this is really about. It's just an anti-Tory. This is having a go at the government. And I have friends who are in the medical profession, and they are excellent. We've got some great doctors, we've got some great nurses, we've got some great staff. But at the end of the day, you go into medicine and you are there your primary purpose is to look after your patient. So I fully support having, what we are trying to do is to get a sort of a minimum standards, if people are looking at industrial disputes, minimum standards in place, which they have across Europe and across the world. But this sort of calling action like this, and also with the junior doctors. We have more than 7 million people on waiting lists. Their argument is, this is about patient safety. We've got people on these waiting lists and they're dying. They're dying. And as soon as you actually have action, then, of course, what you're doing is you're adding to this waiting list because they're then going to not being able to operate or not being able to see the patients. It's dreadful. So
is this an out-of-control union that's bashing the Tories at the expense of patient safety, Michael?
No, I'm also interested in this idea that they're supposedly representing the workers. There have been overwhelming votes in favour of these strikes, and I think that is not particularly mysterious why that's happened. Pay has been cut by 17% since 2010. Now, if you cut a profession's pay by 17%, you can't really expect them to just take that lying down. And I really don't envy the position that doctors find themselves in, because, if I were to go on strike, what would happen? My YouTube show would be down for 2 days. I wouldn't have to have too much of a moral dilemma about it. But if your job is to save the lives of patients, then yes, you are in a really difficult situation. Do you stand up for your rights and to resist a very significant pay cut over a long period of time, or do you go into work? And I don't envy that. And I suppose the compromise they've come out with is there will be a minimum service, so it's going to be Christmas Day cover, is what they're calling it. So it'll be like on Christmas Day. So hold on, everyone. If you are about to have a heart attack or potentially die, do try and hold off, won't you, for the kind of service that you get on Christmas Day. And if anyone's had the misfortune of going to hospitals, I was in hospital for a month, and in that period we had things like weekends, never mind Christmas Day and bank holidays. I remember weekends. The kind of cover and the kind of access to the consultants that you needed during a weekend was completely reduced. Yeah, well, I don't think anyone's going to deny this isn't going to impact patients. I suppose what doctors would say is that what has been impacting patients for the past 12 years now is underfunding of the NHS, and especially since the COVID crisis, whereby we all went out and we all clapped for these people and said, I really think that was a bit of an implicit sort of pledge to say we will value you what you are worth after this. While we're locked in our homes, you are going out there, basically to a war zone, which is our hospitals, and don't worry, we will reward you afterwards. Instead, what have we said? Actually, you need to accept pay cuts, you're greedy, shut up, stop taking strike, you're the people endangering patients. It seems a little bit disrespectful to me. I don't think that's the attitude at all that's been taken. We take a realistic attitude. You also have to look at some of the problems in the NHS. We've just had one of the worst cases on child killing, baby murdering, that we've had in history in this country. My own mother, and going back 20 years, died of negligence. Now, in the round, the amount of money they have to have in the budget because they're looking at medical negligence. And this isn't just recent. So, this whole NHS needs to be, in my view, needs absolute
absolutely reforming. So, we have the police. When you're working on the front line, we have the police, we have the armed forces. We expect them to be there 24/7. And it's laughable when they say, well, we can have Christmas Day cover. Christmas Day cover? I think Michelle's absolutely spot on, because now you've got people, a lot of doctors who've wanted to go in and work, and then the hospital actually, or the union, is saying to them, oh, don't tell them though what day you're going to come in, because what they're doing is they're trying to go in, then find the list has been scrubbed for their surgery, and that's a fact. So this isn't just straightforward. This isn't just about terms and conditions. This is much wider, and they're going to do the same on the first week in October, apparently. Anyway,
would you support that? Where's the end point for you? Do you support, like, guys, you know what, you can all tag team, you can all go on your joint strikes for as long as it takes until you get your 35% pay restoration?
Well, I don't think anyone is suggesting that, right? So I think it's pretty clear that the 35% demand was an opening offer, right? I know for the consultants, they've said all they want is not a real terms pay cut. So at the moment, they're being offered 6%. Inflation is currently 6.8%. So after a 17% pay cut over 12 years, after working like dogs throughout the COVID crisis, they are being asked to accept another pay cut. And you can see why that is deemed offensive by people who are working incredibly hard to save lives. As I say, I don't think this is an easy decision, for them to make, which is why I really don't envy them. I think they're in an impossible situation.
So you would support them keeping going and keeping going?
Well, I would support the government going back into the negotiating room. I don't think Steve Barclay has spoken to these people for 100 days.
But if that's the government's positions, the government said, right, you know what, we've come up with a position that's fair and all the rest of it, that's our final offer.
But they don't think it is fair, right? So, I mean, that's the whole disagreement. Why is it the government that get to say, sorry, negotiations are over, this is our final offer? If the doctors haven't accepted that, then the government are going to have to come back into the negotiating room,
aren't they? The government have a responsibility to look after the public purse. It's the taxpayer. Where do they think 35% is going to come from? It's going to be coming from the NHS budget. It can't come from somewhere else.
Gordon says, why should doctors get a bigger percent pay increase than nurses?
Ludicrous.
Yeah, so the nurses issue is very interesting. Now, I know a number of nurses, and I think that was actually quite unfortunate the way that unfolded. And the reason I say that is because lots of nurses are very, very upset that offer was accepted in the end. Basically, there was a division between the various nursing unions, and the Royal College of Nurses did reject the offer, but a number of other unions accepted it. Now, you could say, from the government's perspective, that's a victory. OK, you've defeated the workforce, they've accepted this pay rise. I think the idea that we are celebrating the demoralisation of our nurses is somewhat...
That's not what Gordon asked. Gordon was just asking, why should they be entitled to more of a percentage increase than the nurses, bearing in mind people already out-earn these nurses by a country mile?
Well, I think the nurses should have got a lot more. And I think it's difficult to say that because one nurse union accepted this, the doctors have to accept what they don't want.
One of my other viewers, he says, I'll put this one to you, Jacqueline, if you don't allow doctors to keep striking to get what they want, then fair enough, but you're just going to force down their pay in a global marketplace for doctors. All that will happen, Michelle, is in a few years or so, people will just leave the NHS and move abroad.
Well, you've also got to look at the cost of training. While medical students do pay a proportion, we also, as the taxpayer, recognising the length of a degree, try and make sure that is funded for them, because it's actually quite difficult and quite expensive. So it doesn't work like that. We have chosen to have a national health service. It's one of the only ones in the entire world, because if you're looking at the continent, Australia and many other places, 95% of that pie will be private insurance, and then they will have a sort of a mini NHS of about 5%.
And last viewer point, lots of my viewers are saying, surely these people go into professions to save lives, not to earn top dollar. David is basically saying, isn't this convenient for some doctors, all this striking, because it presents them with the opportunity to top up their work in the private sector and earn top dollar?
I'm not sure if that is the case or if that is happening. I mean, my sister's a doctor. She's definitely not doing that.
What field is she in?
You what, sorry?
What field is she in?
She works with adults with learning difficulties.
So she wouldn't necessarily have a private practice, or maybe she would have consultations?
I mean, she doesn't do any private work. Actually, she's currently on maternity leave because she's had a new baby.
There is also an element, many can do some private work too, which I don't criticise, by the way.
Well, do you know what? It's a conversation that certainly divides people. Whichever side of the fence that you're on, surely we all do actually want these people to be there, to be focused, to be motivated and giving us the best care possible. But how do we achieve that? That is the point, I think, that will rumble on and on.